Okay, this one's about birth control, so we'll go on the other side. Nexplanon. Why don't more people know about it?
Well, it's really new in Canada, specifically in Manitoba, and there's only a few trained providers that do Nexplanon. So what it is it's a more permanent form, but reversible form of birth control, similar to the IUD, where you can have it placed. So it's a little implant that looks kind of like a bobby pin, maybe a little bit shorter. You have it placed by a healthcare practitioner, and it's good for 3 years. It is a progesterone-only birth control, which means that it's safe in women who are at higher risk of clotting and can't have estrogen. So those women with migraines with aura or a history of blood clots, breast cancer, what have you. It's so slick to put in. I've done the training and I've done the insertions now for a couple months, and you freeze, so it goes in right here in the arm. So I just freeze that, clean it obviously, freeze the area, and then the Nexplanon actually comes with the insertion device. And so I just insert it right there underneath the skin. There's like no sutures needed. I just put like a little steri strip on it and then a pressure bandage, and then it's good for 3 years. Very effective form of birth control. It's actually said to be more effective than a tubal ligation, which is the sterilization procedure. And it's reversible. So you pull it out, you can get pregnant.
What would the weight be if you decided to take it out and get pregnant? Do you know?
So we say with any systemic hormonal birth control, it's 3 months is what we give, but usually 1 to 2 months cycles re-regulate, and then you can get pregnant.
Do you get your period when you're on it? Another question.
Yes and no.
Okay.
So it's kind of like similar to the Mirena. So because it's a constant release of progesterone is what protects and stabilizes the uterine lining. And so it's the withdrawal of the progesterone that leads to a period.
Okay.
And so the stabilization over the 3-year time span can either A, get rid of your periods, which is about 40 to 50% of patients. It makes your periods much lighter. Or if you have really heavy periods, then it'll make your periods normal.
Wonderful. Thank you so much.